typical features and atypical features. It is said that there are three cardinal symptoms of depression: low mood, loss of interest in activities, and easy fatigability. Okay. So, these three are the cardinal symptoms of depression, and there are associated disturbances like poor concentration or loss of concentration, particularly amongst students. Then you have pessimistic views of future, self, surroundings, decreased self confidence. There can be disturbances in sleep and appetite, which are biological symptoms. Usually, in typical symptoms, it is decreased sleep and decreased appetite. There can be self harm attempts and ideas like suicidal attempts, okay, and also decreased libido. So, these are all the associated symptoms of depression. Depending on the number of symptoms and also the severity of symptoms, depressive disorders are categorized as mild, moderate, and severe. And remember, there are atypical features of depression as well. Like, for example, irritability. A person may not show the low mood at all. Maybe it's a irritability for even the minor things, for example, noises of children, the noises of the vehicles moving around. So, even those things keeps irritating them during this mood state. This is irritability. Then increased sleep, particularly amongst female gender and extremes of ages, this is seen. Then agitation, again extremes of ages which have this atypical features rather than the retardation that we usually see in depressed individuals. And also increased appetite, wherein they resort to eating of lot of sweets and all, so wherein which results in weight gain as well, as opposed to weight loss that is seen in typical features. Okay, and there can be a presentation in the form of increased substance abuse rather than any other symptom. So, particularly amongst males, so it can be seen as an increased substance abuse rather than any of the symptoms. Okay, so there can be typical features, there can be atypical features, and remember, all these features have to be there at least for 2 weeks for a confident diagnosis of a depression, because initially I said the mood changes that happens within the normal range doesn't amount to a disorder, right? So it is a persistent symptoms of this set which lasts for 2 weeks are diagnosed as depression.